I saw like my first like teenager that had similar symptoms, that's when I realized that it was probably more COVID related, because I have never, like, to be honest, I've never seen a kid that age actually with this syndrome. Prior to COVID, there was this syndrome called Kawasaki Disease, and so Kawasaki, it's an inflammatory condition. So like we see like about 3 to 4 cases per month at children's, and so it has really similar symptoms in the sense that you have like some skin rash as well, inflammation, high fevers as well too. So we're seeing a decent amount of that, but over the past 3 weeks, actually the number increased significantly to the point where we were seeing up to 20 in about a 2-week time period. So it's almost quadruple the number that we were previously seeing.
Multisystem inflammatory syndrome in children. Perhaps you've seen the wave of news reports making the connection to COVID-19. Children's Hospital of Michigan in Detroit has been treating a lot of cases. Dr. Amrit Misra is on the front lines and has the latest for One Detroit.
The thing that was different about this, like, COVID-related multi-inflammatory disease is that with Kawasaki, rarely you can develop heart manifestations and says that your heart becomes inflamed. But with COVID, we actually were seeing a decent number of kids that had some heart manifestations, meaning that they had inflammation of the heart to the point where they're having lower blood pressures, or their pump of the heart wasn't working very well. And so that was the big difference, actually, the number that came in actually, and the sheer number that we're presenting with heart problems. Yeah, it wasn't a huge amount. Like, I'm kind of say like all the kids who came in with this inflammatory condition related to COVID had heart problems, but a decent portion of them had it. For most of our, actually, even the sickest kids we've had have recovered, actually, which has been, we've been very fortunate, actually, and we're very happy about that. And I think, we're doing good. We still have a ways to go. We're still trying to figure out what's the most effective treatment, actually, what can we do quicker. But I think one of the things that we've realized now is that the quicker you treat, you're less likely you're going to have the inflammation of the heart, as I mentioned, which is one of the worst complications of this. And so we've actually been more aggressive about treating it based on our experiences. And actually, we've had, I think, better outcomes because of it. So it's all a work in process, but I think we're making right strides in the right direction.
It wasn't that long ago that these first cases came up. Were there many in Detroit, or how did that work where we are nationally?
It's interesting because I think we started seeing we had heard about, I think the week before we started seeing our first cases, we had heard some rumors from New York and then in Europe as well about some of these cases. And then that week later, actually, we started seeing kind of our decent amount of cases here as well too. And it kind of stretched over a 2 to 3 week period, essentially.
Well, explain a little bit more about this disease. Kawasaki has some of the same traits, but what are those and what's different with what we've got going on now?
Yeah, so, with the one that we're seeing right now, the main thing is that the inflammation seems to be a little bit more severe, actually. So with Kawasaki, again, you get very similar symptoms. You get rash, you get a red tongue, you get also red eyes as well, too. And then sometimes there's these blood vessels that get food to the heart called the coronaries. Sometimes you see some inflammation of them too. Yeah, it doesn't happen all the time with Kawasaki, but you do see it a decent number of times. With our kids with this inflammatory disorder with COVID, we were seeing a lot higher prevalence of that, actually. The other thing is that the symptoms actually were a little bit non-specific. You're having, previously what was described for COVID was people were coming in with usually breathing problems, so like cough, trouble breathing, and then fevers and everything. For our kids that were coming in, actually, they were coming in with abdominal pain, nausea, vomiting, and diarrhea, which was a little bit different. And the other thing, too, is that, previously, like the studies that were described in China and Italy, the patients that were having COVID with kids, actually, they weren't that as symptomatic, actually. Some of them had some respiratory difficulties, others didn't. But the kids that were coming in now, actually, they are all having these different GI symptoms, which wasn't previously described as well, too. And they're also having the heart problems as well, too. So this is all different than what we had heard before, actually. So when we started seeing more and more of these cases, we realized that this is probably related to COVID itself. The other thing that we did is that we started testing these kids for COVID just because of the times. And so some of the kids came back positive, but a good portion didn't. And so we started doing the antibody testing that's now available. And a good portion of those kids actually were antibody positive for COVID, meaning that they didn't have necessarily had signs or symptoms of COVID currently, but they were previously exposed to COVID. And so that kind of begged that this whole syndrome itself may be a post-inflammatory disorder for kids that had exposure to COVID, and then their body for some reason is having a inflammatory response based on their previous exposure.
The number last week was there were 17 cases were active at Children's Hospital.
Yeah, it's come down actually. Kind of the good thing is that our treatment has been working actually, and so a lot of the kids that we've been seeing actually have been treated actually. Actually, we're discharging them actually. So I don't know the exact number off the top of my head, but it's less than 17 now. It's been good actually. We've had actually almost 100. We have essentially had 100% success rate between the treatments we've been using, and most of the treatments that we've been using are anti-inflammatory medications that we use for Kawasaki, but we've kind of expanded them as well too for this syndrome as well too. One of the theories behind Kawasaki is that there are certain viruses that may trigger it itself. So we were wondering that if COVID was acting in a very similar way, or that a previous infection kind of stirred something within your body that came up later, where your body's response to these antibodies was to cause a large inflammatory response, just based on your previous exposure. And so that's one of our theories behind all of it. Again, we don't know the exact mechanism that why COVID and why some kids have this inflammatory response versus others, and even why some kids develop some of these heart issues versus others. But we're trying to learn as we go. But that's one of our current thoughts, is it's related to this inflammatory response from having these COVID antibodies.
We've heard cases of other people having COVID and having problems like blood clots and that sort of thing. Does this relate at all to what you're looking at here?
It's interesting. I haven't seen kids with blood clots per se, actually, but we do end up putting these kids on some blood thinners, especially the older ones. We put them on blood thinners, and the younger ones we put on aspirin just to prevent the risk for actually more inflammation. The aspirin is more for inflammation, but for older kids, it's based on the adult literature. We've been actually putting them on blood thinners. Haven't seen it yet, but again, like the whole situation, like the whole syndrome is an inflammatory condition, and actually inflammation can predispose you to developing blood clots, and so that's why we don't like to take any risks, and that's why we tend to put these children on either aspirin or a blood thinner if we have a higher suspicion for it.
You're seeing reports of over 100 children in just New York that have come down with this, and then you have the cases here in the Detroit area. Is there a lot of communication among doctors nationally about what's going on with this thing?
Oh, of course. That's kind of the nice thing about with all these social media and everything, that we're actually been in contact. I've been texting pediatricians I know elsewhere. Other pediatricians have been reaching out to us. We're all actually talking about what our experiences have been regarding taking care of these patients. And so it's been kind of nice, actually. We've had different thoughts. We know here at Children's, we know of some of our previous trainees here are at New York right now. And so they've been telling their experiences, and we've been telling them about our experiences. So it's been nice. There's been a lot of cross-institutional collaboration about what to do and how to approach these patients, which has been very helpful.
What about you're a parent or you're even a kid and you're not feeling well? What are these symptoms that you might have, and what should you do about it?
Symptoms that we have been telling people to look out for is, again, a high fever more than 2 days, but also abdominal pain, nausea, vomiting, and diarrhea. Those are especially in our teenage group and our younger, preteen group. Actually, that's what we've been seeing. For the younger kids, actually, they do develop a very widespread diffuse rash as well too. They also can develop a red tongue and red eyes as well. What I've been telling actually families that, if I think there was a lot of fear about going to the doctor's office or even calling the doctor just because of the number of COVID cases. The COVID cases have come down quite a bit. So I encourage families to reach out to their pediatricians actually if they have any concerns regarding any symptoms that their kids are having. The other thing too is that going beyond COVID as well is that, we want actually our kids actually to come into their doctor's office for child checkups, because that's one of the things that we've been missing actually is that, some of their kids aren't getting their immunizations or aren't getting their regular routine healthcare. And so I encourage families actually, if they have any concerns COVID related or non-COVID related, that you should feel free to go to your pediatrician's office or reach out to your pediatrician, because we really want to get our kids back into the medical system so we can take good care of them.
You can find more at onedetroitpbs.org or subscribe to our social media channels and sign up for our One Detroit newsletter.